President, I rise in opposition to Senate Joint Resolution 37, which we are now considering and which we will vote on at 5:30. This is a resolution that would use the CRA process to undo the CDC guidance requiring use of masks on transportation, planes, buses, trains, and some transportation hubs. I think this is an issue that should be discussed, and possibly, to use a medical metaphor, a scalpel should be used to make it just right. Unfortunately, the CRA process is a meat cleaver, and this is not the kind of thing we should be using a meat cleaver against. If Resolution 37 passes, it could lead us to be extremely vulnerable if there were a resurge in coronavirus cases, as we are seeing in other nations like Germany. Let me explain. The CDC imposed a mandate to wear masks on transportation in February of 2021. Again, planes, buses, trains, and train and bus stations, as well as airports. We all know that the CDC has recently examined the caseload of COVID-19 in the country and dropped their mask recommendations for most of the nation. About 98% of the American population now live in communities where there is no mask recommendation. Thank goodness. Not even indoors. That's great. But in some parts of the country, some parts of my Commonwealth, infection rates are still so high that the mask recommendation for wearing indoors is still one that the CDC strongly recommends. The CDC mandate with respect to masks on transportation was set to expire on March 18, On Friday, March 18, it was set to expire. After the CDC dropped the recommendation about wearing masks indoors, the CDC decided to extend the mask requirement on transportation for 1 month, from March 18 to April 18. Why did they do that when they were dropping the mask recommendation indoors for much of the country? Well, the reason was pretty obvious, and they explained it. Here's the problem with transportation. You might board a bus, plane, or train in an area with low infection, but pass through areas of high infection and end up in an area of high infection. And so transportation is a little bit different than what should the rules be in an indoor venue in my hometown of Richmond or in communities in Connecticut where the presiding officer lives. So what the CDC said is, we're going to take an additional month and we're going to analyze the science around closed spaces, transportation venues, and we're going to look at this issue of traveling from one community to another, and then we'll come up with a best recommendation and best guidance with respect to mask mandates in transportation. That sounds very reasonable to me. Very reasonable to extend the mask requirement by 1 month. And I would argue to my colleague, Senator Paul, this is his resolution, we should be weighing in with the CDC and giving them best guidance, and obviously they're considering what science is recommending. They're in dialogue with the transportation industry that has strong feelings about that, and then seeing what guidance the CDC comes up with in April before the April 18 deadline to which they've extended. That would be reasonable. But what this resolution does is not reasonable. It not only wipes out the mask requirement, it wipes it out forever. It states that the CDC no longer will have the authority to impose a mask requirement in transportation unless or until this body passes new legislation allowing them to do so. That legislation in the Senate would require 60 votes. I would venture to argue that there is no way in the politicization of COVID that a piece of legislation giving the CDC the power to do mask mandates in transportation would get 60 votes in this chamber. So if Resolution 37 passes, we will have taken away from our premier Health Organization the ability to impose a mask mandate if it's necessary. Now, I pray that it's not necessary. I'm happy to see the reduction in COVID caseloads in Virginia and across much of the nation. But there are parts of Virginia where the caseloads are still high and where masks are still recommended. And there are parts of every one of our states or commonwealths where the infection rates are still high and masks are still recommended. And so it's fine to wish that COVID is going away. I mean, Lord, do we all wish that it's going away? But we know that in some parts of the country it isn't. And we also know, if we're looking at the data internationally, that China is experiencing a significant upsurge. Germany is experiencing a significant upsurge. And so what if we face a new COVID variant that starts to wreak havoc on us just as Delta did when we thought we were in a decline, just as Omicron did when we thought we were in a decline? What if there is a new variant that comes and starts to wreak havoc more broadly across the country? Wouldn't we want the CDC to have the power immediately upon an upsurge of COVID nationally to impose a mask requirement on transportation? If Resolution 37 passes, they will not have the ability to do that. And what might be the consequences of that? The consequences could be very severe in terms of people's health. We know that. We've experienced now close to 1 million deaths to COVID, but it also could have severe economic consequences. Our transportation infrastructure, public transit, and buses and trains and planes is a critical backbone of the American economy, which is now starting to grow and add jobs, thank goodness. But if COVID hits again and CDC does not have power to impose a mask mandate, many people who use transportation to get to work or to travel to places where they can do their work will no longer feel confident in their ability to do so. Many employees who work in the transportation sector will worry about being exposed to rising COVID case levels and may choose not to work. And so the consequences of another COVID surge in this country are not only health consequences, but they are critical potential consequences to our economy at a time after 2 years when finally we're seeing some significant GDP growth and job growth and wage and salary growth. So I would urge my colleagues, don't use a meat cleaver. When this mask mandate is set to expire on April 18, it's barely more than a month away. Don't use the meat cleaver to bar the CDC from taking necessary public health action should there be a resurgence in COVID. Instead, let's work with the CDC and see what guidance they come up with for this April 18th deadline. That would be much better for our public health and much better for our economy. And so for those reasons, I would urge my colleagues strongly to stand with smart economic policy and wise public health policy and not eliminate the ability of the nation's premier public health agency from imposing a transportation mask requirement should public health demand it. And with that, Mr. President, I yield the floor.